Bryan Johnson has been diagnosed with autoimmune gastritis. I'm Dr. Rabia De La Torre. I'm a board-certified gastroenterologist, and I'd love to explain to you what this condition is. But before I do, there's one really important thing I have to say. Online, there's a lot of fodder and a lot of people talking about the fact that he has this diagnosis, and some of those people are actually mocking him and taking joy in the fact that he has an autoimmune condition, despite all the money he spends on his health. I think that's one of the corniest things I've ever seen in my life. It's so messed up to make fun of somebody for having a medical condition, no matter what you think about them. Never make fun of a patient, never make fun of somebody who has a medical condition. Autoimmune gastritis is a type of atrophic gastritis, meaning the lining of the stomach becomes thin and the actual folds, which would be nice, thick, fat folds in the stomach, become kind of flat. It's a condition marked by chronic inflammation. It impacts 1 to 2% of the population. People can either be asymptomatic or they can have symptoms that are kind of like vague abdominal pain. Things we see on lab work is that they can be iron deficient and they can also have low B12 levels associated with an anemia, and that's called pernicious anemia. Confirm the diagnosis by biopsying and seeing that there's atrophy in terms of the actual histology when we look at it under a microscope. They might have autoimmune thyroid disease as well. People with autoimmune gastritis are at increased risk for certain autoimmune conditions like autoimmune thyroiditis and also type 1 diabetes. They have a very, very slight, small increased risk of gastric cancer, and they're also at increased risk for something called neuroendocrine tumors in the stomach. We have no definitive proof to say that certain foods you eat or certain lifestyle or habits are going to cause you to have autoimmune gastritis. What's the mechanism of inflammation? So your body has something called CD4 positive T cells. Normally these help you fight infection, but in autoimmune gastritis, these actually attack the acid pumps in the stomach, and so your ability to actually pump acid into your stomach, which is a normal function that we all have, is impaired because these pumps are being attacked by the CD4 positive T cells. These cells also then activate B cells to create antibodies against intrinsic factor and parietal cells. When you have low acid in your stomach, this inhibits your ability to actually absorb inorganic iron, and that's why you have some iron deficiency, and that can be one of the first signs of autoimmune gastritis. There is no standard treatment for this disease itself. The treatment is focused primarily on managing the iron deficiency and the B12 deficiency.